It's one of the most profound and miraculous journeys in a woman's life. It's a journey filled with growing love each week, sometimes with worry, sometimes with indescribable excitement. And at the end of this 40-week adventure, one question always comes to mind. Is normal birth better or C-section? In fact, both types of birth have their own advantages, risks, and special circumstances. What truly matters is protecting the physical and emotional well-being of the mother and ensuring that the baby arrives safely. That's why choosing the method of birth is not only a medical decision, it's also an emotional, psychological, and deeply personal one. What is normal birth? Normal birth is one of nature's most natural processes. Through regular contractions, the baby is delivered vaginally. According to the World Health Organization, a healthy delivery usually happens spontaneously between the 37th and 42nd weeks of pregnancy. The biggest advantage of normal birth is that the mother can stand up and return to her normal routine shortly after delivery. She can breastfeed her baby immediately, and a strong natural bond is formed. A woman's body is designed for this process. The uterus, birth canal, and pelvic structure all work in harmony to prepare for birth. There are 4 types of pelvis in women: gynecoid, android, anthropoid, and platypelloid. The most common and birth-friendly type is the gynecoid pelvis. A successful labor depends on the harmony between the uterus, the pelvic structure, and the baby's position. Stages of normal birth labor occurs in 4 main phases. Phase 0 is when the uterus is at rest, usually up to the 36th week. Phase 1 is the preparatory phase, where irregular contractions and pressure sensations occur, but true labor hasn't started yet. This is known as false labor. Phase 2 is the active labor phase. The uterus contracts regularly, and the cervix begins to dilate. And phase 3 is the postpartum period, the recovery phase that lasts about 6 weeks. The first stage of labor is the cervical dilation phase. This stage lasts about 8 to 12 hours for first-time mothers and 6 to 8 hours for subsequent births. Contractions occur every 2 to 3 minutes and last about 30 to 45 seconds. The first stage has 2 parts: latent and active. During the latent phase, the cervix dilates up to 4 centimeters. During the active phase, labor truly begins. If this process lasts more than 12 hours without progress, it may indicate a problem in labor. The second stage is the delivery of the baby. It usually takes 1 to 2 hours for first-time mothers and about 30 minutes for those who have given birth before. The third stage is the delivery of the placenta, which typically takes 30 minutes to an hour. Mothers often notice certain signs before labor begins. The belly drops lower, pelvic pressure increases, and the bloody show appears, which is the discharge of mucus and blood as the cervix softens. Once these signs appear, labor usually begins within 48 hours. Advantages of normal birth. Normal birth, as the name implies, is a physiological process. After giving birth, the mother can quickly return to her daily life. Communication with the baby is uninterrupted. Breastfeeding starts easily, and milk production increases. The hormone oxytocin, which is released during labor, strengthens the emotional bond between mother and baby and enhances happiness. However, being natural doesn't mean it's risk-free. Difficult labors, a narrow pelvis, or a large baby may cause vaginal tears. That's why sometimes in episiotomy, a small surgical incision is made to protect the tissues and prevent deep tears. Who cannot give birth naturally? In some cases, normal delivery can be risky for both mother and baby. For example, disproportion between the baby's head and the mother's pelvis, breech or transverse baby position, placenta covering the birth canal, signs of fetal distress, previous uterine surgery, multiple pregnancies, active infections such as genital herpes. In such cases, a C-section is the safest option. What is a C-section? A C-section is a surgical procedure in which the baby is delivered through incisions made in the mother's abdomen and uterus. It can be either a planned operation or an emergency procedure, usually performed under spinal or epidural anesthesia. The mother remains awake but feels no pain. She can experience the moment her baby is born and hear that first cry. A C-section typically lasts between 45 minutes and an hour. The mother usually stays in the hospital for 2 to 3 days, and full recovery may take 6 to 8 weeks. Advantages and risks of a C-section. The greatest advantage of a C-section is that it can be life-saving for the baby in risky situations. When the baby is breech, the umbilical cord has prolapsed, the placenta is blocking the birth canal, or the mother has conditions like high blood pressure, heart disease, or diabetes. A C-section is the safest option. However, it's still a surgical procedure and not without risks. Possible complications include wound infection, internal organ injury, bleeding, or hernia at the incision site. Postpartum pain tends to last longer, and recovery takes more time compared to natural birth. In Turkey, the C-section rate is around 55 to 60%, which is well above the global average. Of course, C-sections are not always bad choices. What matters most is medical necessity, the doctor's recommendation, and the safety of both mother and baby. What is an epidural? Painless birth. Epidural birth is one of the most common methods for pain-free delivery. Anesthetic medication is administered to the lower back, blocking pain below the waist. The mother remains conscious and experiences the birth without feeling pain. However, there are some drawbacks. Labor can take longer, contractions may weaken, and sometimes assisted delivery may be needed. What is water birth? Water birth, which has become increasingly popular in recent years, takes place in a warm pool or tub. Water helps relax the mother, eases contractions, and increases comfort and mobility during labor. It can also make the transition smoother for the baby, who has been surrounded by fluid for 9 months. However, it's not suitable for everyone. If the baby is breech, there's a risk of preterm birth, infection, or multiple pregnancy. Water birth is not recommended. Final thoughts: normal birth or C-section? There is no single right answer. Every woman, every baby, and every birth has its own story. The right decision is the one made with your doctor based on your health, the baby's position, and your inner intuition. No matter how your baby enters the world, what truly matters is the mother's peace and the baby's health. Every birth, every mother brings a miracle into this world. Remember your birth, your story. If this video has guided or inspired you, don't forget to subscribe to my channel and join the I'm Mother is Born family. Let's walk this beautiful journey of motherhood together with love and trust.